We currently know that we don't have enough providers that really meet the needs of the communities that they serve. And policy can play a big role in really smoothing that pathway so that more people from diverse backgrounds can come into the profession and meet the demand, whether it be in rural communities with underserved populations. It would make a significant difference if we had equitable ways of bringing folks in that really spoke to how they can practice more easily to meet that demand. If we were able to streamline this process so folks could navigate the licensure piece more easily, we could double our workforce in a pretty significant way.
State policy shapes the workforce in the mental health professions, and it's essential that we get policy right there. There's policy at the level of the state law, and there's also policy at the level of the rules created by the board. And often there's a lot of interest and maybe even competence in being a therapist on the part of the workforce, but that runs into the buzzsaw, it can sometimes feel like, of regulation. And so it's important for us to get that regulation right to protect patients, but not to restrict entry into the profession.
Today's conversation was a lot about regulation and how much of it is needed and what needs to be done. And I have been working in regulation for 30 years, and that's kind of a pendulum. You have this kind of maybe regulation isn't needed, and then something happens that doesn't protect the public, and it swings back over that it's not strong enough, and then it'll swing back over. So I think working and continuing to realize that it's not perfect, but it's there, it's needed, and how can we continue to improve it, I think is very important.
It's important for us to streamline licensure for mental health providers because, over half the people who've done the educational requirements to become a therapist don't actually go on to get licensed. That means that we could double the workforce of therapists just by having more reasonable licensure requirements. And there's a real mental health crisis and an access to care problem in America.
Just because something is the way it is today and has been that way for a long time doesn't mean it can't change. We were able to change a lot of things pretty quickly in Utah because there was this moment where the legislature and others realized that we just didn't have enough workforce. And I think a lot of states are facing that. Innovations, reforms, changes, there's probably more of an opening now than there has been in a long time. And so I would just urge people not to be bound by kind of the rigid structures of the past, and we can rethink this now.
I think it's really exciting for the future of access to care and reasonable regulation that we have some states like Utah who are really taking a hard look at what's the cost benefit of this regulation. What are the parts of this regulation that actually help patients and help make providers safer, and which just serve as artificial barriers to entry to the profession and actually make the mental health in the state worse off. I think a lot of states could learn from Utah's example.
We all came in with different perspectives, and we came in with different ideas, and we were able to work together and think about ways that each one of us could bring something to the table that might be an option going forward, and do it in a way that was very cordial and I thought really insightful.
Advocacy is something that we can all do. There are steps that you can take no matter where you sit that really could move us forward in the mental health profession to meeting the workforce shortage by making it easier for folks to come into the profession and stay in the profession.